Good morning, everyone. My clock says 9:30 and I'd like to get started on time, so welcome. Thank you for joining us for the Regional Overdose Prevention Coalition virtual conference. It is our 11th conference altogether and our first time we're doing this virtually, so welcome. This portion will be locked down so that we ask you not to show your videos. And we are interested in just having our speakers highlighted for this portion of the conference. We are going to start off with thank yous. There are quite a lot of people who put quite a lot of effort into this conference, and I want to make sure to thank all of the executive committee, to thank Vital Strategies for grant money to help us put on this conference, to thank Prevention Point and Health Federation, both of Philadelphia, who have graciously donated time and materials, location, all that kind of stuff, as well as staff expertise, Caroline, Martin, Morgan, who have been helping us with this, and for the rest of the executive committee. For this portion, we are going to just have a very brief highlight from each county. We're going to start go in alphabetical order, and then as each person speaks from their county, the next person's going to jump right in with their presentation. All of these are going to be very brief, so if you have questions, hold them to another time, and we will wrap up this section with a brief update on the ROPC itself. So with that, I'm going to turn it over to Mallory Parati, who is going to give us a brief update on Bucks County.
Thank you, Renee. Just a quick, can everyone hear me? All right, great. So good morning, everyone. I'm really excited to be here, and we're having our next ROPC conference. It feels like it's been a really long time. And just again, a quick thank you to everyone on the executive committee and everyone Renee mentioned. So I'm Mallory Parati. I'm the prevention supervisor with the Bucks County Drug and Alcohol Commission. We're the single county authority here in Bucks County. So I'm here to share a few updates about what's happening in Bucks. You'll notice a trend that much of what I'm sharing today involves partnering with law enforcement. Many of the diversion programs and other pilots can happen because of law enforcement providers and other partners. So I'm going to start with our Bucks County Police Assisting in Recovery, or BPAIR program. This is a program that began several years ago in Bensalem and has now expanded, thanks to funding from the PA Department of Drug and Alcohol Programs, to about half the jurisdictions in Bucks. The expansion includes coordinators who can work with departments in helping individuals access an assessment or other community-based supports. We also have two other pilot police diversion programs. We have the Bensalem Community Response Unit program, which is a specialized response to overdoses and other substance-related emergencies that occur in Bensalem and is activated by a 911 call. And another program, again activated by a 911 call, is our newest pilot beginning in February of this year. It's called the Falls Township Supporting Recovery, or FTSR program. It's a collaboration between law enforcement and CRS. These programs are possible because of collaborations with Family Services Association of Bucks County and local hospitals. Recently, we received a Vital Strategies grant, which allows us to expand our Narcan outreach and plan community Narcan drive-through events. We're excited because we're going to be partnering specifically with faith-based organizations for our first couple events. In addition, we are exploring the installation of nalox boxes in several communities, and again, hoping to install in some high-risk areas such as hotels and motels. Lastly, over this summer and fall, we're planning several trainings here in Bucks. We're planning a stigma training for law enforcement and healthcare professionals, specifically hospital emergency department staff. And in the late fall of 2021, a symposium for Bucks County law enforcement and partners. So here we'll have Bucks County will be able to showcase law enforcement and human service collaborations, looking at trends, and a one-year review of the co-responder program in Bensalem. And that is all for Bucks County, and I will turn it over to Vince.
Thank you, Mallory. My name is Vince Brown. I'm the director for the Chester County Department of Drug and Alcohol Services. And just to give you a quick overview of what's happening in Chester County, we've taken a multi-pronged approach pretty much over the last quite a few years now, including public awareness and education, prevention, intervention, and treatment, initiatives around law enforcement, as well as public health and different harm reduction services, as well as many others. Just a few of the examples have included public awareness and education campaigns, which included billboards, posters, bus shelter advertising, as well as mobile apps on phones and websites. We've done a lot with internet and Facebook updates and events. A primary focus has been to ensure appropriate prevention, intervention, and treatment services, including the enhancement of medication-assisted treatment in our county. There's also been involvement in coalitions. There's an overdose prevention coalition in the county, which is an effort, a coordinated effort between government departments, including our department, community organizations, and treatment providers. And of course, we're also a participant in the Regional Overdose Prevention Coalition. Narcan has been a focus with the purchase and distribution to county and community agencies. There's also been a lot of public training and distribution of Narcan, and police departments throughout Chester County, and municipal police in particular, all now have Narcan in each of their vehicles, and I believe it's also in most of the state police vehicles. EMS also is carrying Narcan, and just a positive note that we don't often think about, just in 2020, there was 440 plus overdose reversals just between EMS and the police department. We also have an initiative that's been going on now for 3 or 4 years, including that's involving a warm handoff project. That's an effort to engage overdose survivors in our 5 in-county hospital emergency departments and connecting them directly to treatment. We also take that opportunity to engage any family members or friends who may be with them or involved, providing Narcan and other resources and support. We've also done a lot with our hospitals in partnership, providing in-services training for the 5 in-county hospitals, and also providing information to doctors and other professionals on topics including prescribing guidelines, access to treatment services, medication disposal, those types of things. And we've also reached out to some that we may not have normally thought about, as far as providing information to physical therapists, funeral home directors, hospice workers, oral surgeons, dentists, and minute clinics. We've been focusing also on supporting the medication collection in Chester County. There's currently 28 collection sites throughout the county. In 2020, there was a collection of over 2.3 tons, which is actually down from the previous year, mostly due to COVID. One of our newer initiatives is our emergency medical services and first responder partnership. We're actually piloting a program as we speak that includes EMS training on substance use disorders and engaging with individuals with the SUD. Also a Narcan leave behind and information leave behind program for individuals who survive an overdose, and leaving that for them as well as their family members. One of our things that is currently on a back burner, but we're moving it to the front, is looking at a LEDI, a law enforcement diversion type of program. So that will be something that probably in the upcoming year that will be a real focus. So you can see there's a lot going on. I think it's really important to realize that there's a lot of lives that are being saved. There's a lot of positive impact on families and communities. Unfortunately, we still have a lot to do. But you know, with the partnerships we've created and continue to work with, you know, we're moving forward. So that's it for Chester County at the moment.
Good morning, everyone. I'm Dana Ratchko. I'm the interim acting drug and alcohol administrator for the Delaware County Department of Human Services Division of Drug and Alcohol. The first update I would like to mention is our single county authorities treatment needs assessment was approved by both the PA Department of Drug and Alcohol Programs and our county council. Our priorities will focus on lack of transportation to recovery support services and treatment, language barriers, and lack of interpreter services, warm handoff issues, lack of available social and recreational alternative activities, and workforce issues. So we will work towards our measurable outcomes and goals related to those priorities, gaps, and barriers related to treatment. Delaware County was also awarded multiple different funding streams this year to work on special projects. The first program I'm going to mention is our Finally Home program. We were awarded funding from the Department of Drug and Alcohol Programs to continue this program, which focuses on housing and case management focused housing. So that provides 6 months of rental assistance for individuals who have opioid use disorder or stimulant use disorder. The SCA was also awarded funding from the PA Department of Drug and Alcohol Programs for a police diversion project. So our police diversion project will also partner with the LETI program through the Delaware County Office of the District Attorney, and will work together to train all 42 of the police departments in Delaware County in how to access services and assessments for those with substance use disorder. The next program I want to mention is funded by the Department of Justice Bureau of Justice Assistance, which will run out of our prison, George W. Hill Correctional Facility in Delaware County. This grant is called the Comprehensive Opioid, Stimulant, and Substance Abuse Site-Based Program. This grant will provide buprenorphine access and recovery port services to inmates at George W. Hill. I also want to thank our councilman, Kevin Madden, who was a driving force in getting this program and funding into George W. Hill. The last special project I want to mention is funded by Vital Strategies. We will also be partnering with Vital Strategies to offer 3 Narcan distribution sites during up until September 30th, as well as outreach to hotels and motels in regards to Narcan kits, but also our CRS services, and just re-educating the community that our CRS program is up and running and individuals can reach out at any time if they need help for themselves or their family members. And I think that's it for Delaware County, and I'm going to pass it off to Montgomery County.
And I am county's overdose data and coordinator. I'm actually covering for my worker Pam Bell, who is an active of ROPC but could not be here today. So I'll tell you about a couple projects excited that we're able to start this year. So Montgomery County's pleased to announce that the implementation of a county enforcement treatment initiative known as LETI has started. This is spearheaded by our Attorney General's office, Montgomery County District Attorney Office. This program of building upon SCA, provider, and law enforcement collaboration and integration, and allows for individuals with substance use disorder to access treatment and through police departments. Law enforcement officers encounter individuals with a substance use disorder, they can them on this program and refer them by calling a call center operated through GodNet. This partnership emphasizes the importance of all stakeholders working together to show individual families that recovery is possible and help available. Montgomery County has also started an overdose review team in which various stakeholders from across our are reviewing cases, discussing ideas, policy changes, ideas to remove barriers and overdose from occurring. This is currently run through a collaborative between our Office of Public Health, our single county authority, and the coroner's office. Montgomery County is committed to continuing to collaborate regarding various harm reduction strategies. And through a partnership, Prevention Point and Vital Strategies, we had our first harm reduction sub meeting to really jump off these discussions. This plans to enhance and expand county harm reduction methods, build awareness about various programs, establish additional ways to reduce. And that's all from Montgomery County.
Hi, everybody. My name is Zoe Soslow. I am the Central Administrator for the Philadelphia Department of Public Health's Overdose Fatality Review, ODSTAT. And I'm really excited to be here today to have the opportunity to talk about some of the work that's coming out of our Division of Substance Use Prevention and Harm Reduction. So our work over the past year or so is focused on reducing overdose mortality by expanding access to harm reduction resources, community education, and cleaning up neighborhoods that were specifically affected by the drug trade in Philadelphia. This past year, we launched 2 media campaigns. The first was a 3-month media campaign to raise awareness about the risk of overdose indoors and encourage anyone who lives with or knows somebody who uses drugs to store naloxone at home. And that campaign was called What Keeps a Family Safe at Home, Naloxone. The second was a fentanyl education campaign aimed at raising awareness about the presence of fentanyl in non-opioid drug sources, including stimulants and hallucinogens, and distributing fentanyl test strips and naloxone to neighborhoods hardest hit by overdose, many of which are new hotspots in majority Black or Latinx neighborhoods. We also launched substanceUsePhilly.com that provides up-to-date data on everything relating to substance use in Philly, including data on overdoses and hospital stays, perinatal outcomes, arrests, drug seizures, and treatment. We were also recently able to collaborate with Vital Strategies to award mini grants to 7 community organizations, primarily led by people of color, to build harm reduction capacity and address the rise in drug use and overdose in Black and Latinx communities in Philly. We're also supporting several efforts to increase linkage and treatment and other services, including funding for Philadelphia's major health systems and building a case management program at Philadelphia jails. We now also have 3 full-time social workers in our bereavement care program who provide one-on-one and group support to individuals who have lost a loved one to overdose. We continue to conduct quarterly overdose fatality review meetings in ODSTAT and have 40 recommendations to date that focus on reducing overdose fatalities and morbidities associated with drug use from a variety of standpoints. We also launched Project Reach, a team of 7 full-time staff dedicated to cleaning up trash and drug litter in Kensington, in addition to providing harm reduction, outreach, and education. So Project Reach collected almost 12,000 syringes and 3,000 bags of trash in 2020. And in addition to their cleanup efforts, they also distributed 562 doses of Narcan and about 1,200 fentanyl test strips in 2020. Finally, really proud to talk about our harm reduction team. In 2020, they distributed almost 50,000 Narcan kits and a little over 18,000 fentanyl test strips to mutual aid groups, community-based organizations, outreach organizations, educational institutions, and individual community members. And this year to date, our harm reduction team has already distributed over 22,000 Narcan kits and almost 50,000 fentanyl test strips. They've also provided 983 people with Narcan trainings throughout 63 trainings, and 589 people have been trained in how to utilize fentanyl test strips. So thank you so much for being here this morning and for the opportunity to share a little bit about Philadelphia's updates. I'm really grateful to work with such a driven group of people who share their goal of reducing overdose and ensuring people who use drugs have the bodily autonomy and are safe and cared for.
Thank you. Well, very, very much appreciate the efforts of Mallory, Vince, Dana, Netta, and Zoe. And of course their whole team behind them as well. I'm going to now share my screen and just give you a brief presentation on the Regional Overdose Prevention Coalition, our history, and where we're going next. All right. I'm Dr. Renee Cassidy. I didn't introduce myself in the beginning and realized right now that I neglected to do so. I am an internal medicine and pediatrics physician. I'm currently the co-chair for the ROPC, and I work in primary care and administration for a clinic for the uninsured in Westchester, Community Volunteers in Medicine. We all know that when a crisis reaches a peak where people start noticing, dozens of organizations feel compelled to respond, and often this results in 22 different task forces and charities and committees and things like that, each of them addressing an aspect of a problem from their own viewpoint. But I think those of us in the coalition know this may not be the best way. So the Regional Overdose Prevention Coalition started back in 2016 with conversations regarding could we potentially coordinate some of our efforts as various people are working together to prevent overdose. This started in December of 2016, and our first conference was organized in March 2017. It was in between two conferences that were held on safer prescribing, known as the Scope of Pain, which is an organization out of Boston, one of which was held in Philadelphia and one of which was held in Delaware County. And in between the 2 days that those were held, we had our own conference, which was really just a conversation. But when we had this interactive discussion, we had lots of people tell us that this was a worthwhile discussion. And so in 2017, we moved on and continued with 2 additional conferences for a total of 3 that year. By the time we got to the 3rd conference in October of 2017, felt that the feedback we were getting from all 3 conferences was positive, and it was worth continuing our efforts. So we made arrangements to sort of formalize the organization. That's when the executive committee was determined. We had some subcommittees created, and the Regional Overdose Prevention Coalition name was born for the organization. In 2018, we held 3 additional conferences. In 2019, we held 3 additional conferences. And in 2020, we planned for 3 additional conferences. There were other things on the agenda, however. So we did hold 1 conference in 2020 in February, right before the pandemic hit. And this now is the result of the long delay between the 2020 conference and the 2021 conference. So what have we been doing? We have addressed a wide variety of topics. We want to be very, very collaborative and very broad in terms of who we're inviting to the table to have conversations and collaboration. Most of what we have done has been the conferences themselves. And in addition to this type of conference, which you're participating in now, we've had payer collaborations where we've gotten both medical and behavioral health, both public and private insurance companies to the table to have discussions, which have gone very well. We've had a couple of those, as well as having 1 conference targeted at elected officials and being more educational as to the kinds of things that may be helpful when they are considering legislation. Our main focus in all of this, all of our conferences and emails and things like that, is connecting people with each other. So networking is a primary activity that we do, as well as communication and education, sharing resources. And behind the scenes, while you guys may not see it, there is a lot going on to keep things running. So there's a lot we've done in terms of self-organization. So our vision is the elimination of all harmful effects of substance use on individuals, families, and communities in the region. And our mission, in order to bring this about, is to bring together stakeholders to work as regional partners to reduce harms of substance use. We have had many leaders over the years. We're approaching our 5-year anniversary at this point in terms of our discussions. And I want to specifically call out Mark Osterberry, Rosemary Halt, Diane Rosati, Lori Devlin, George Downs, Michelle Hayward Ramsey, Laura Fedorowicz, and Dave Brown, all of whom have served on the executive committee at one point or another over the years and have now moved on to other things. We can't have done it without them. Their efforts were very much appreciated and still are today. And I think a number of them are actually going to be able to be at our conference today. So if you're out there, hello. We also want to express our appreciation to everyone who's participated. We've had a lot of project leaders, subcommittee chairs, speakers, and you, the attendees, who have engaged with us to make this a successful organization. Very briefly, I'm going to show you who's our current executive committee. We have at the moment 12 people. I'm not going to read all this off, but Pam Bell is from Montgomery County. I am a representative of Chester County. Jerry Daly is an at-large representative because he works regionally in multiple counties. Marie is a Delaware County representative. Kate is a Chester County representative. Silvana is a Philadelphia representative. David McKeegan has been a representative for both Delaware County and Chester County. Mallory is with Bucks County. Dana is with Delaware County. Ann is with Philadelphia County. Zoe is with Philadelphia County, and Dan is with Philadelphia County. So we have had a lot of people participating over the years. This slide deck will be shared with you so that you can read a little bit more at your leisure, the brief bios that we've presented, and certainly you can contact me via email or on Twitter if you're interested in more information.